The northern areas of Vietnam offer breathtaking landscapes at every turn. Steep, terraced mountains form a maze of peaks dotted with small villages in the valleys. Residents of these remote communities face significant geographical and financial barriers when seeking medical services. In addition, people from ethnic minority communities who don't speak Vietnamese also face a language barrier. As a result, TB detection can be delayed or missed entirely, which leads to sustained disease transmission, illness, and economic hardship. Through collaboration with the Vietnamese government, we hope to empower communities of people affected by TB to make high-quality TB screening and treatment services more accessible and person-centered for remote communities. The German embassy in Vietnam funded a community-based mobile chest X-ray TB screening campaign in Yên Minh district of Ha Giang province, using new portable diagnostic and screening technologies. Additional funding from the Stop TB Partnership's Challenge Facility for Civil Society was used to empower members of ethnic minority groups to build awareness about TB in their communities and advocate for access to the highest quality services, including TB preventative treatment. Prior to the screening events, this funding helped build a community network to provide post-campaign TB care, including contact investigations and treatment adherence support. The Challenge Facility also funded research about the financial burden associated with accessing TB care and TB-related stigma. We first established a community engagement group comprised of village health workers and local volunteers. Then we collaborated with Vietnam's national TB program, the Ha Giang Provincial Lung Hospital, and the Committee for Ethnic Affairs to produce an informational handbook about TB disease and treatment in Vietnamese. The cartoon characters in the handbook were designed to wear clothing that accurately represents those worn by the local Hmong community. Since literacy levels are lower than the national average in this community, the handbook was animated into a video with voiceovers in the Hmong language. When mobilizing key and vulnerable populations for TB screening, the volunteers use these materials to engage their community members and raise awareness about TB. Now we will follow Mua, a 32-year-old mother who has been in close contact with someone who has TB. Her interaction with the health system begins when one of the project's volunteers visits her at her home to invite her to attend an upcoming mass TB screening event in her hometown. The success of this project hinges on our ability to present information in a manner that can be understood. Fortunately, our teams have received extensive training and are completely prepared to raise awareness in each ethnic community we encounter. We've been working tirelessly to encourage individuals to participate in screening events and subsequently connect people with TB to appropriate treatment as soon as possible. There will always be challenges when you're dealing with terrain like this, but through the efforts of the project and our community support team, I hope that we can really make a difference in these remote regions and raise TB awareness to improve the levels of prevention and care. When Mua arrives at her local commune health station, she is registered and verbally screened for symptoms and risk factors of TB. However, only 60% of people with TB in Vietnam will report symptoms. Therefore, a chest X-ray is required to detect the remaining 40%. Following the verbal portion, Mua is then screened using an ultra-portable handheld X-ray, which can be easily transported to remote screening locations like this one. Her X-ray is read on-site by both a radiologist and artificial intelligence software to ensure interpretation quality. When her X-ray is found to be abnormal, she is asked to walk outside and provide a sputum sample for testing. Mua's sputum sample is transferred to an on-site laboratory where PCR testing is conducted for TB. During this campaign, we use the TrueNat PCR assay, which is capable of detecting TB and drug resistance. The testing system is battery-operated, making it ideal for screening campaigns in remote locations. Following this process, Mua is asked to complete a TB stigma and gender survey specifically designed for her community. The hospital is located far away, making it difficult for me to visit the doctor. Today, that changed. I was fortunate to participate in a free health screening event that took place right in my community. I'm grateful and feel like I was treated with the utmost respect. I also gained TB knowledge that I can bring back to my neighborhood to raise further awareness. On the following day, Mua is visited again by the project's community volunteer to deliver the results from her sputum test. We are pleased to report that Mua was found to be healthy. If she'd been diagnosed with TB, she would have been urged by the community volunteer to initiate treatment at her local district health center. She is asked if she has any remaining questions about TB or other health conditions. Lum Ho is a remote commune located 40 kilometers south of the center of In Minh district. There is high mountainous terrain in which resides 23 villages with 2 ethnic groups living together. Through this screening campaign, every resident has understood how important it is to safeguard their health, to protect the people they care about most, and society in general. It also helps reduce TB transmission in the community. Lastly, I would like to thank the leadership at all levels. The leaders of the Provincial Lung Hospital, District Health Center, and In Minh District Hospital for paying great attention to the residents so they can participate in this screening campaign. Once again, thank you all. The Ha Giang Lung Hospital, together with FIT and other partners, have coordinated and conducted this TB screening event through an extensive network of community volunteers. We have implemented lung health screening activities, especially TB screening, at health facilities. Even though the event is ongoing, we have already screened many people for TB. This is a great opportunity to raise TB awareness, especially to improve access to healthcare and screen ethnic minority communities for TB and TB infection. I hope that NGOs and other organizations will receive additional funds for In Minh District and Ha Giang Province so that residents can have access to the best healthcare services, especially TB screening, so that we detect more TB cases in the community. Thank you all. In Minh District of Ha Giang Province, over 2,100 people were screened with chest X-ray, resulting in the diagnosis of 17 people with TB. This detection rate is 4.6 times higher than what you would expect from the general population of Vietnam. These results highlight that community-based approaches for healthcare service delivery can directly improve health outcomes for remote communities. This TB case-finding strategy is now being scaled up across multiple provinces with the support of other donors. The survey data collected during this screening campaign will be analyzed, shared with the local Hmong community, and interpreted by them. Investments such as this one, which are dedicated to providing a voice to TB-affected communities, can be used to strengthen strategies that address the geographic, financial, and language barriers among remote populations in Vietnam to accelerate the fight to end TB.